All right, we'll go ahead and get started. Welcome to the Gallatin County COVID-19 press call today. My name is Holly Whaley. I'm the communications website specialist here at Gallatin City County Health Department. Today we have on the call Lori Christenson, our Gallatin City County Health Officer, Kallie Kujawa, who's the Bozeman Health COVID-19 Incident Command Lead. We also have Tracy Ellig, who's the Vice President of University Communications at MSU. Today we have a couple special guests as well. Dr. Kathryn Bertany, she's a returning speaker. She's a pediatrician hospitalist and the president of Bozeman Health Deaconess Hospital and Big Sky Medical Center. And Kiera Pattison might be joining us she is our System Director of Nursing and Deputy Planning Section Chief for Bozeman Health's Incident Command Team. So kick it off to Lori.
Great, thanks very much, Holly. I'm gonna go ahead and share my screen. Appreciate everyone joining today. Okay, so we'll start with our epi update. As you can see, we are seeing an increase in cases. When we compare the 7-day rolling average of daily cases per 100,000 residents, from this week to last week, we are seeing about an 11% increase. Again, that's from 55.9 cases per 100,000 as of the last reporting period to 62 cases per 100,000. So we're definitely seeing an increase. One thing to note is the April, back here in April, we have surpassed, as of this point, not right now, our epi curve has surpassed where we were in April of just a few months back. Of course, our highest peak was back here in November, but I just wanted to kind of give that as our reference points. In terms of daily and 7-day average percent positivity, we are currently seeing our 7-day rolling average of percent positive is 14.6%. That is above the 10% red line here. What I would like to say about this is just encouraging individuals continue. If you're feeling sick, you should be tested. This is an indication really of high transmission in our community. Median time from specimen collection to public health remains 1 day, which is good. And a couple of things I want to say, or one piece I want to say about our vaccine first dose administration rate. As of right now, as of our last or most recent data, 70% of Gallatin County residents who are eligible for a vaccine have received a first dose. That's an incredibly important benchmark. That said, we know that full protection protection is best with 2 doses on board. So please continue to vaccinate. If you haven't received your second dose of vaccine, please make a plan to do so. If you haven't received your first dose, please make a plan to do so. So I wanted to just highlight that as of most recent reporting period, Gallatin County residents who are eligible have received 70% we've reached that 70% threshold, which is great. We have a lot of work to do to get everyone vaccinated that we need to. In terms of vaccination by age group, not a significant change in terms of by age group. We continue to see an increase. We're currently, as of Gallatin County, as of right now, is 59% fully vaccinated. And as I said earlier, we need to continue to see more people vaccinated. Here are our active cases in our K through 12 schools, including Montana State University. And we continue to be in high transmission. Again, that's evidenced by the number of active cases we have, but we continue to be in high transmission. And again, with that high transmission, we recommend that people, whether you're vaccinated or not, are wearing a mask in indoor public places. So I'll let Kallie talk a little bit about the critical care bed and hospital capacity. Before I do that, Kallie, I just wanted to share last week as well. I'm not sure, can't remember if it was Juliana, asked a really great question about breakthrough cases by age. So I'm going to stop share and share a new slide. Great. You should all be able to see, hopefully. There we go. Breakthrough cases by age. So what I want to say about this is the highest frequency of breakthrough cases is occurring among those 20 to 59. The highest percentage of breakthrough cases is occurring among those 60 and older. So I know I had received this question last week, and I wanted to make sure I shared these data with you. Again, highest frequency is among those who are 20 to 59, and the highest percentage is occurring in those that are 60 and older. So with that, I will turn it over to Kallie for any additional remarks from Bozeman Health.
Great, thank you so much, Lori. Once again, I'm Kallie Kujawa. I'm Bozeman Health Incident Command Lead. I really do appreciate you all joining us today. As I shared on Wednesday, we have had some significant updates in the past 24 hours that we thought were very important to share with the community. Today, we currently have 15 COVID positive patients. Our critical care unit at Deaconess Hospital has 20 beds and is currently at 90% capacity, leaving us at this exact moment with only 2 open beds. 6 of the patients in our critical care unit are COVID positive, with the remainder being other healthcare needs. Additionally, our medical unit is at 90% capacity with only 4 open beds. We have 1 COVID positive hospitalized patient at Big Sky Medical Center. And what I'm hoping you're gathering with this information is that our current situation is not good. Our physicians, our nurses, respiratory therapists, and all of our other clinical staff are exhausted. We are facing likely imminent move into crisis standards of care while we pursue right now all potential contingency strategies to increase physical space, to shift patients, and to increase staff. We are preparing for a surge of hospitalized patients and are actively working to get those surge units ready to accept more. As healthcare providers, this is absolutely devastating. We are here to care for people. Caring for others is our calling, and we want people to be healthy and well. And being faced with a possible position to have to make a decision to look at one person's survivability versus another to determine who gets care is incredibly difficult. We don't want to be in that position. We don't want your family members to be in that position. We don't want your friends or anyone that you care about to be in that position. I also want the community to know that because of our hospital situation, that you will now likely start to feel those effects on this when in your seeking of your regular healthcare needs. We are working to keep as many services open as possible. We have not yet, as of this moment, had to temporarily halt services in any area. However, we are working to redistribute staff right now to support Deaconess Hospital and Big Sky Medical Center. You may have longer wait at urgent care or in calling to make an appointment. Your COVID test results may and likely will take longer to be resulted. We are doing the best that we can. Please be kind, be patient, recognize that we are all in a near impossible situation. Again, every employee at Bozeman Health is doing the best they can, being exhausted, burnt out, and yet still giving 100% to every patient when they're here. Patients and visitors yelling and screaming at our employees or complaining on social media is not appropriate or helpful, and it could further damage the workforce we so desperately need right now. This is a time to support our healthcare workers and to care about yourself, your family members, and your friends. I mentioned earlier that our critical care and intensive care beds were full earlier this week and continue to be nearly full every single day. We are building out a surge care unit in our old nursery. This will be overflow for our critical care unit and our medical unit as needed. Lauren will share a photo of that space that is being renovated for this use. Our team is transitioning it into negative pressure, which helps mitigate spread of any infectious diseases through the flow of a particular air pressure. This surge care unit will hold between 6 to 8 patients in one room. They will not be allowed visitors. They will not have private rooms. This unit will be operational by 8 a.m. on Wednesday. We hope we don't need it tonight or ever, to be completely honest. COVID-19 is not made up. It is not a conspiracy theory. This isn't about politics, it's about people's lives. We know the vaccine is safe. Our healthcare workers need your support right now more than they've ever needed it during this pandemic. Wear a mask indoors and in public spaces. Stay home when you don't feel well. Seek care when you need to. At this time, I'll turn it over to Dr. Bertany for further comments. Thank you. Dr. Bertany, you may need to unmute.
Thank you, Kallie. And thank you for sharing the detail of some of what's going on inside the hospital right now. Just to add a little more up to date, we currently have, of our 20 beds, 7 of our patients are on ventilators, and we anticipate putting an 8th on a ventilator by the end of the day. And we have 6 patients who are requiring high flow nasal cannula, which is sort of a step before you get to the ventilator. And we have 2 that are on BiPAP, which is the step between high flow nasal cannula and the ventilator. So we have, of our 20 beds, probably 16 of them by the end of the day will be patients who are critically ill with respiratory illnesses. I share this because you heard our number of COVID positive when we started the day in the hospital was 14. The majority of these patients in our critical care unit are in fact COVID positive patients. However, since our community has relaxed some of their infection prevention standards, we have seen a tremendous surge in other respiratory illnesses as well, which are serious infections for children, as well as those at-risk adults who are also going to be at risk if they were to get COVID. And we are just seeing the demand for our acute care critical nurse team and the physicians far outstripping the capacity of our team to be able to sustain this. If we are at the level I'm expecting, although we will still be within standard of care, we won't be able to get to the patients as frequently for the checks, because one person can only do so much in any given hour or 2-hour period. And so in addition, we are trying to expand our ability to safely deliver these aerosolizing procedures, whether it's high flow nasal cannula, BiPAP, or a ventilator. That's why we're opening a new unit. That unit, as Kallie mentioned, is not ideal. The patients will not have an individual room. We will do our best to preserve privacy. It will be negative pressure, and it will not be safe to allow visitors. And that is not the ideal healing healthcare environment that we have come to realize as our standard of care and what we want to be able to provide for our community. So I will double down on the plea of others who spoke before me. Make a plan to vaccinate and be sure to wear a mask when you're out in public. And I will add to that by please avoid large public gatherings. Large public gatherings could include sporting events or music events, even if you're outside, especially if people are vocalizing excessively. Anything they have, they're sharing. That is an aerosolizing event at that point, and a huge risk of transmission. And those that are vaccinated can be asymptomatic carriers and transmit to those who are unvaccinated. Finally, in talking about our baseline situation, I think to understand that we are now on allocation for a number of different medications or have limitation in the supply chain and our ability to get certain equipment that we need to care for patients. So every morning we talk about what we're short of, what we're scrambling to get to make sure that we have all the equipment we need to care appropriately for the patients that present to our hospital. And a great example is the monoclonal antibody that we used as a prophylactic medication for high-risk individuals when they test positive. And it is on an allocation from the state. And we were on a call earlier this week where there are other hospitals who've had to say, I'm sorry, you came the day after we ran out of our medication, and we don't get another allocation until 3 days from now. And that is just not a message that we as healthcare providers ever want to have to give, that we know what to do to help you, but we just don't have access to the medications or the equipment that you need to get better. And it's certainly not something that you want to hear for yourself or your family member. So we can all help to make sure that resources are available for those who unfortunately do need that by trying to prevent ongoing spreading and transmission of this disease.
Okay, thank you, Dr. Bertany. Tracy, MSU.
My name is Tracy Ellig. I'm the Vice President of Communications for Montana State. So shortly after we started the semester in late August, we implemented a mask requirement for all of our indoor instructional spaces with a notice that we would reconsider that on October 1st. This morning, we decided that we would go ahead and extend that mask requirement indefinitely, but also expand it. So it's been expanded to not only indoor classroom spaces, but all additional indoor spaces. So hallways, offices, the student union building, the library, our residence halls, our dining halls. And so that message went out about 10:30 this morning. Like everyone else, we continue to urge students, faculty, and staff to make a plan to get vaccinated. For students, faculty, and staff, vaccines are free and they're available right here on campus at our university health partners. We have a very easy web portal where they can schedule a vaccine, and we continue to encourage that really strongly. Thank you.
Thanks, Tracy. At this point in time, we can open it up to questions.
Hey, Lori, I have a quick question. And I have two questions. One's for Kallie, one's for you. But my question for you would be, and this is kind of a broad question, but taking everything into consideration, vaccination rates, cases, what do you think is the biggest thing that Gallatin County residents are struggling with or are being challenged by at this point?
When you ask that, do you mean in terms of, in context of the number of cases, or what in context of what?
Kind of as in context with the pandemic in general, with just, I guess, not being over this, not getting that 100% vaccination rate, just kind of general, just what are we struggling with the most right now?
Yeah, boy, if there was one single thing or two single things that I think would be sort of address everything we have related to the pandemic. I think the biggest thing and you wouldn't be surprising, but at this point in time, it's getting those vaccination rates up. You really need to get those vaccination rates up. So I can't speak to everybody's individual beliefs about the vaccination. What I can say is that we know at this point in time, and the evidence demonstrates that the vaccine is safe and effective. Millions of doses of vaccine have been administered. So at this point in time, really the vaccine continues to be the most important strategy that I want everyone to really continue to focus on as our community.
Perfect, thank you. And my other question's for Kallie. What was the name of the room that you said was being transformed?
Yeah, you bet. It's our old nursery. We, Dr. Bertany here had to coordinate getting a whole bunch of storage equipment removed out of that space so that we could open it up for patient care. But it's our previous nursery.
Perfect. Thank you, guys.
For
Other
infants,
questions?
I want to make that clear. That was a space for newborns, not for adults, but we're actively working very hard to get that space ready. I don't know if Dr. Bertany, you want to say more to that?
Sure. Just to give you some idea of the space, it is where we used to care for generally well newborns, but we did have med gas and suction and all of the appropriate outlets for when babies needed advanced levels of care, even without transfer to a higher level nursery. So we are able to bring in beds and put them in this large open room, as the picture showed that Lauren gave to you, separated by curtains, which aren't ideal in a situation where you've got people with an infection that's spread through aerosolization. So we're figuring out how to minimize the infectious risks from one to the other, but we will only cohort patients who have COVID and no other respiratory illnesses. It will be staffed with 2 appropriately trained nurses, as well as an aide and a respiratory therapist. It will have negative pressure so that we can perform aerosolizing procedures. It will be an extension of our critical care unit. So we essentially are taking a 20-bed critical care unit and turning it into a 26-bed separated by a hallway. And unfortunately, I anticipate that we will need this as early as next week. And so we are all hands on deck getting it ready. There were people who were working in the space. There was a lot of storage in that space as it was vacated after we opened the new Family Birth Center last year. And that was a cascade of multiple other things, and making sure we have a functional code call system in the room so that if anything were to become a concern for a patient, that our caregivers have a way to rapidly get help, but they will be immediately adjacent to other acute care units, and so won't be isolated. It is an ideal location, and we're lucky that we have that space to use. Other hospitals are turning conference rooms into a place where they care for patients with portable suction and portable oxygen, and if it doesn't get better, we could get to that. So I'm really hoping not.
Other questions?
Can I just make one other comment about our capacity at Deaconess, which is last year when we opened the new critical care unit and the Family Birth Center with the NICU, we expanded our capacity from a total of 86 beds to 125 beds. We are now, through emergency traveling and temporary staffing all of those 125 beds. And 10 of them are NICU beds. So we'll say 115 adult beds. And we're still needing to open more crisis beds in a non-standard unit where patients will not have their own room and not even have curtains all the way around, because it's not safe to do that. So I just really need the public to appreciate that when you're hearing about other communities where they're entering crisis standard of care, and we're hearing about other states creating a state of emergency and having to make really difficult decisions about who gets the care and who stays on a ventilator because they don't have enough of them. Today, we're not in that place, but I just say today because honestly, I don't know if I'll be able to say that next week if it keeps going in the trajectory it is. We have filled every bed that we have that is a licensed space, ready and equipped to care for the community. And now we're opening another 5%. And we could need to find other places where we can put much less ideal care spaces that would definitely alter to a crisis level standard of care. Thanks.
Thank you. Other questions?
I had probably an annoying amount of questions for you guys. I'll start with Kallie or Kathryn. We're hearing a lot about crisis standards of care across the state. I think for a lot of us, that's kind of the first time we're hearing about what this is. So I just had a couple of general questions to kind of clarify what that means for people. I guess the first one is, does that mean patients who go to the ER will be turned away? You know, if you go to the hospital, will you be turned away? Will you not get care? I think that's something people are wondering.
Kallie, do you want to take this or would you like me to?
Either way, you go for it. And if you need some help, I'm here.
I'll start and then you can add on. So in crisis standards of care, we may have individuals who have more patients to care for than they can safely care for on normal ratios. And we may extend what individuals can do to help them who are not licensed or certified to provide that level of service. We may, as I'm telling you, have medications that aren't available or equipment that's not available. And we have to make very challenging decisions and partnerships with our ethical committees on how to distribute care, when to start a treatment or when to stop a treatment. And although we will always care for everyone who presents to our emergency department, and I'll tell you that while we're on this call, I just got a text to come and see if I could find a way to socially distance the crowd that is in our emergency department right now. How quickly we can get to care for each individual presenting is going to very much depend upon the volume of patients that are presenting at any one given time.
Right, so you should definitely still go to the hospital if you need care.
We definitely want you to seek care where you need it. If appropriate, going to one of our urgent cares, which are also seen about 4 times their normal volume right now. So anticipating a wait when you present, if it is not a life-threatening condition. If it's a life-threatening condition, you absolutely want to come to the emergency department or call 911. Kallie, maybe you want to give more detail on some of the changes that we make under crisis standards.
Yeah, so if we look at the state of Montana's document that they put out on scarce resources and on scarce resource management and crisis care guidance, they talk about what conventional care is, which is typical care that you see in a hospital setting all the time. They talk about contingency care. So that's that next level. We're deploying contingency strategies. We're shifting staff around. We're, it says here it's functionally equivalent to routine care, but equipment, medications, and even staff may be used for a different purpose or in a different manner than typical daily use. And then when you look to bump into crisis care, which is absolutely defined in that document from the state, it says that crisis care falls at the far end of the spectrum when resources, and those are people and equipment and medication and those types of resources, are scarce, and the focus changes from delivering the best available appropriate care for each individual patient to delivering the best available appropriate care for the patient population as a whole.
The other question I have, I think I know the answer to it already, but does declaring that crisis standard of care, does that get any additional resources or support from the state?
That's a really good question. Just 2 days ago, we put in a request for National Guard resources. However, our guarantee on getting those is not great. They're already deployed elsewhere for other types of emergencies beyond healthcare emergencies. So although we can put out a request, we have no way of knowing if that will get filled.
Sure. That's bleak. The other thing I was going to ask, so with staffing issues, I was curious if you knew how many like open positions you have and kind of how big of an effect staffing issues is having. That kind of all plays into this. That's obviously one of the resources that's like identified in that scarce resource plan.
Go ahead, Dr. Bertany.
I can take that. We have about 2,600 positions total at Bozeman Health, and we have over 400 open positions right now. And those range everything from our clinical positions, such as nurses, respiratory therapists, lab specialists, individuals to work in our imaging department to be able to run MRI, CT, ultrasound, and X-ray, all the way to all of our support team members who are just as critical in our environmental services to clean the beds and assure that we have appropriate infection prevention and nutrition services to be able to prepare and deliver the food. So I would strongly encourage anyone in the community that is looking for a job to please look at the Bozeman Health website. We have many entry-level positions that have opportunity for great advancement. So for example, the aides on our floors only need a high school education. And we oftentimes will work with them and support them in education, and they turn into some of our greatest techs or nurses. And we would love to be a part of the future of anyone's vocational goals. So yes, we have many, many open positions and desperately need applicants.
Cool, thank you. And I'm sorry if I'm taking much time from other people who want to ask questions, but I did have some questions for Lori about the wastewater treatment. I guess the first one is, so is it right now just Belgrade, Three Forks, and Bozeman that isn't getting wastewater treatment testing? Is that correct?
Bozeman is, thank you for the question. So Bozeman has just come back online. They'll be starting to sample.
Okay. And then I guess I was kind of curious. I know it was kind of a bigger thing last year, and I'm trying to remember all the stories I read last year, but what is the data for that wastewater sampling used for? And do you guys really factor that into any kind of decision making, like on a public health side?
Sure, thank you so much for asking that. So the wastewater data, we use those data to help detect virus load in a particular community. And it has the potential to be an early warning sign for COVID-19 spread in the community. So oftentimes if we are maybe not seeing a number of cases in a particular community, but we're seeing wastewater data reflecting something different, that could be an indicator that there's not enough testing, there's enough transmission in a community that it's showing on the wastewater data. So we use it a lot as a overall indicator of where we are in terms of COVID-19 spread in a community. It's at this time, it's not used specifically as a metric for basing specific decisions off of. It helps us understand and communicate to the community. We continue to have virus transmitting in our communities, and we have to continue to take all the precautions we possibly can.
Awesome, thank you. And then do you know why it stopped here in Bozeman? I think I'd heard it was like a contracting dispute or something like that. I'm trying to remember. I don't remember what you told me last night when I was asking.
Yeah, definitely not a dispute. It was more of just a pause,
Okay.
and then a pick back up, which has happened, which has occurred.
And I guess with this big spike that we're seeing now with cases, do you think not having the wastewater data earlier, do you think that would have helped us catch anything with this wave? I don't know if I'm asking the question confusingly, but.
No, I understand why you're asking. And no, I mean, the reality is that then the wastewater data allows us to really identify if there's kind of what the virus load is. With the transmission rates that we've seen, having the wastewater data that Bozeman specific location wouldn't have changed the response. We would continue to encourage people to take the precautions that we have been asking the community to do.
Thank you.
Yeah, thank you.
I'll stop hogging all the time now.
That's okay.
Thank you, guys.
Other
Hi.
questions? Oh, go ahead.
This is Iris with the Associated Press. And I was just wondering, and this question is probably for you, Lori, if the county can take any sort of action at this point to help address this spread and this surge, if there's any sort of actions that are permissible, given sort of what the legislature has done.
Thank you, Iris. I appreciate the question. That's a question that I, as a public health officer here in Gallatin County, continue to explore and want to explore every possible legal avenue that we have to address this concerning rise in the number of cases and the stress we see on our healthcare system. As you know, the legislative changes have definitely complicated the scene in terms of immediate action that public health authorities or boards of health can take. So as I've shared before, at this point in time, any COVID-19 measures would need to go through the city and county commissioners in order to implement any new measures or regulations that would require what we saw in last year during the pandemic or the early part of the pandemic. So at this point in time, again, I continue to explore options. I'm in constant contact with our city and county commissioners, our boards of health, the partners you see here, to identify opportunities to slow transmission, because it is clear that we need to do that now in our community.
And just a quick follow-up, I'm curious if you can elaborate a little bit about what steps you would take, maybe if your hands weren't tied, or what steps you're considering or discussing with the county commissioners.
Yeah, so as you know, public health across Montana and in many other states across the nation implemented regulations as they relate to wearing a mask and indoor public places. As of right now, that stands as a recommendation. At this point in time, there are no serious conversations to move that towards a requirement. We're trying to navigate the complexity of the law and explore opportunities. So at this point in time, there's nothing that we have explored with any certainty as to next steps for our community. What I will say is, and what we have said from the very beginning, we know what measures we need to take. We know that wearing a mask can help spread, reduce transmission. There's nothing stopping an individual from putting on a mask when they go into an indoor public place or in crowded places outdoors. We also know that a vaccine can help slow transmission and stop serious illness, specifically can really stop serious illness and hospitalizations. We also know that limiting your time in a gathering with a lot of individuals or in indoor spaces with a lot of individuals can also slow transmission. So those are steps that the community can take without regulations in place. Any other questions?
Hey, Lori, I know I'm not a reporter, but I did have a question since this goes out to the community for our Bozeman Health folks, if you'd allow me to.
Absolutely, Ms. Vermes.
So Kallie and crew, there are a lot of wonderful people in our community that heed these recommendations. They've gotten vaccinated, they wear their masks, they wash their hands, they stay away from crowds. They also want to really support our healthcare workers right now. What can they do to help your folks out and make them feel supported?
You know, I think bringing just encouragement and kindness and empathy when they do visit us and they see us, when they come to our facilities, acknowledging the work that everyone's doing when they witness it. And you know, as friends in the community of healthcare workers, asking them how they can support them and their families. We have people working overtime and a significant amount of overtime, and knowing that their families are supported is huge. And so all of those types of additional members or things that we would do as members of this community to support one another are absolutely paramount right now. Dr. Bertany, what would you add to that?
Well, I'll throw out there, honestly, healthy food and snacks. Food goes a long way to bring comfort, and our teams are working very hard, and oftentimes it's even hard to get away from the unit to get to the cafeteria. And because of staffing limitations, our cafeteria hours, it's not open past 6:30 at night, and it's not open in the middle of the day anymore. So from somewhere around 10:30 or 11 until it's open for lunch again, and then closes until it's open for a couple hours at dinner time. So there are many times if you're working a 12-hour shift, or you've been working a 12-hour shift and now you're asked to stay on call because things are a little busier than anticipated and we need extra hands, and you've offered to do that, you may have no way to get to food. So this week, our resiliency committee has delivered food to the night shift a couple nights, and we're very grateful today for a pizza delivery that came and for the coffee trucks that have been showing up at some of our locations. We've had to close our coffee barista stations on campus because we do not have enough people to staff them. And I will tell you that not having caffeinated healthcare workers makes it a lot harder to work long hours. So it sounds minor, but small gifts of healthy treats, I'm sure would be welcome by any of your healthcare providers, whether they're at Bozeman Health at the hospital, Big Sky Medical Center, out in any of the clinic locations, or honestly at any of our partners that are working so hard to take care of patients in our community right now. Everybody's busy and tired and probably a little bit hungry.
Thanks, Whitney. Other questions out there?
Lori, I have a quick question for Tracy.
Okay, please go ahead.
With just news of this mask mandate extension, I know that there's a growing community on campus. I've seen an online petition of, I think, between 800 and 1,000 signatures in opposition of the mask mandate, of people who want it repealed. But with this news of an actual extension, what do you say to that community who may feel like their voices are not being heard, or that it's that their freedoms are being violated against? What do you say to that community?
I would say that at the beginning of, prior to the start of the semester, the university, the president asked students to participate in wearing masks voluntarily as a matter of personal responsibility. 2 days after the start of the semester, we saw complete disregard for that request to voluntarily participate. And so we have gone to a mask requirement. And we will continue with the mask requirement because our request for voluntary compliance was not heeded.
Perfect, thank you.
Tracy, I recall also that when you did go to a mask requirement, you offered students the option of a refund if they chose not to attend. So there was an option for those who felt that that wasn't the right environment for them, just to back you up on that.
Yeah, Kathryn, just to clarify, what we did is we extended our full refund deadline by a week past what is historically published. So yes, but that, to be clear, that full refund doesn't exist today.
Other questions? Okay. So I want to just close this out. This has been a really hard thing for this press call. Has been hard for me to hear because I think you can hear and listening to our partners, their pain, the frustration, the desperation in their voices. I can hear it. I can feel it myself listening to our partners today. So our healthcare workers here locally and across the state are begging you to take this virus seriously. This situation is dire and will only get worse if we don't come together as a community and take all of the well-vetted steps that we know can stop the spread of this dangerous virus. Our actions impact far more than just ourselves. They impact our entire community. Please help our healthcare workers out, help your neighbors out, help your loved ones out by getting a vaccine, wearing your mask in public, and staying home when you're sick. As you can hear today, we need your help. And with that, I'll close it for today. Thank you so much for everyone joining us. Please take care of yourselves and we'll see you next Friday.
Thanks for
Thank
the
you.
opportunity.
Guys.